If I go to one grocery store and buy bananas, the price is listed right by the bananas. If I go to another grocery store, the price might be different, even if it's just a couple blocks away, but I know what those prices are when I walk in the store. Why can't you do that with healthcare? Hello and welcome to the Hi-Fi Health News Podcast. I'm Erika Grotto. Today we're talking about the complex and often confusing world of healthcare pricing. Here to help us untangle this one is Shawn Stack, a policy director at the Healthcare Financial Management Association. Shawn, I don't even know where to start with this topic, so let me just ask you, how does healthcare pricing even begin?
Well, it's a great question, Erika, and I think it varies from organization to organization. So, yeah, pricing methodologies vary very much from organization to organization. And you're right, they are highly complex. For example, gross charges or charge master charges or whatever you want to call them may be based on a combination of factors, including the highest allowable charge for a particular service in payer contracts, cost, which may or not include various indirect expenses, and then marketplace considerations. You can imagine healthcare provider salaries highly fluctuate based on region of the country and whether the hospital is located in rural or urban settings, as well as is it more expensive to live in certain areas of the country rather than others? And all of that influences the cost of healthcare because healthcare providers must be paid accordingly to where they are, where their setting is, and what their community is and where their communities are based. So setting prices for healthcare services is impacted by a number of factors, and those factors vary from hospital to hospital, in short. Not even really in the same, even hospitals within the same organization could have different cost structures based on the communities and the states in which they are located in.
So the pricing starts with the hospital, the provider organization, but health insurance comes into the mix too. How does that work?
Yeah, so I mean, health insurance comes into a mix based on contracted rates. Also, keep in mind, Erika, and I know you know this, another key factor in establishing prices for services are, of course, the cost of healthcare items and supplies. So negotiating power based on the size of the organization also comes into play. Healthcare supply chain pricing was, of course, extremely volatile during the pandemic. And we continue to see fluctuations based on inflation and, of course, tariffs that the administration has imposed on certain items and services made outside of the United States. And like I said, typically larger health organizations can secure deeper discounts or for higher volume services than smaller health organizations can. And that's why we have started to see strategic alignment of more than one hospital going in on supply chain demand in their areas. One of the most expensive and rapidly changing costs in healthcare is the cost of pharmaceuticals. Pharmaceuticals can highly influence, the charging for supplies and procedures within healthcare. And then, of course, spikes in certain illnesses or infection rates at certain times of the year or environmental factors also play in the pricing of pharmaceuticals and medicines.
So I want to talk for a second about, you mentioned the contracted rates with the insurers. So a hospital could set a price for a certain service or procedure, and then they have a conversation with the insurance company, and those numbers might not match, right? How does that work? And how do you get from the hospital sets a price for something to this is what the patient sees as the price?
So within your payer contracts with your payers, if you're a hospital, you negotiate reimbursement with that payer. Now,
And by payer,
many
you mean
times,
like your insurance company, right?
your insurance,
Okay.
right? Your insurance plan. So keeping in mind that the insurance plan or the payer also needs to show savings to the employer that they're contracting with to cover their employees' lives. So that is very important for a payer to display or an insurance to display to someone they're working with to secure their members for insurance, right? So they want to prove that they can secure a 60% savings if that large employer goes through that specific insurance company. So those dynamics also to play into setting the prices, not by the hospital, but what the payer is demanding the hospital to set that price at, if that makes sense.
Yes, yes. So one of the challenges for patients is knowing exactly what the cost is going to be. And we've talked about estimates and things before. But if I go to one grocery store and buy bananas, the price is listed right by the bananas. If I go to another grocery store, the price might be different, even if it's just a couple blocks away, but I know what those prices are when I walk in the store. Why can't you do that with healthcare?
That's a great question, Erika, and I think that's something that legislators, regulators, hospitals, providers, insurers have been trying to crack for at least the last 10 years, the last decade. It's complex. Some services, some medical services, I would argue, can be priced that way. Diagnostic services where you're running tests to find out what is wrong, such as x-rays, CT scans, lab work. Typically, those types of services, those diagnostic services, hospitals and providers can give you a pretty sure price, right? There's a little bit of difference if I need to run something with contrast versus non-contrast based on your body or based on the disease that I'm looking at. But pretty much you can give folks the price for that. Now, differently, several different answers to this question, but you and I are similar in age. You're a female, I'm a male. If we both break our hip, we're both going to go into the hospital to get our hip repaired. I may have more underlying conditions than you do that are chronic, which would make me heal much slower, and I might be subject to different complications. If we both are at a 4th of July celebration and we both break our hip and we are both right around the same age, that doctor does not know what our comorbidities are, our different diagnosis codes or different diagnosis and chronic conditions until they get us in the hospital, right? So that's one of the reasons why, because they don't know the complexities that each one of us has in our medical history. They don't know how to price that out. Another reason for that is, for different prices is, if you go to a hospital, let's say, that performs only 3 tonsillectomies per month, they may charge close to $9,000 for a tonsillectomy, while a hospital performing 50 tonsillectomies a month may charge between $2,000 to $4,000. That's realistically possible. The higher volume facilities are often, not always, but often more efficient, and they're more likely to benefit from better supply chain pricing and optimized workflows, which can reduce costs significantly when you get into medical procedures. So really, what I'm saying is, some services I do think we are getting closer to offering you a list price, such as diagnostic services, but other services we still are working with, maybe that one type of service or item isn't quite as commonly provided by that provider, so it's a little bit more expensive to get there. And then others can be cheaper with that provider because of, there's the staff salaries, the region of the country, supplies are less expensive, capital costs are less expensive. There's just a lot of factors that play into that. And I think that's where we're at right now, is trying to figure out how do we get that best estimate to that patient on those more complex procedures. Does that help?
It does. So tell me then, if you need, let's say, a tonsillectomy, what's your best course of action to make sure you get the best price? If you can't call up and say, how much do you charge for this? Then how do you make the decision if price is factoring into where you go for that?
Well, you can still access that information through price transparency files, through what's the average price of a hospital that performs a tonsillectomy or performs a procedure. You can call and get that price and compare those prices. But just know that that price may not match from hospital to hospital because of these different factors, and that might be why. And that's why there's a lot of conversation going on right now in healthcare and has been going on in healthcare. Is that price alone what you should be looking at as a consumer? Do you really want the cheapest price out there because of quality outcomes or whatever? You might, because maybe that cheaper price is a facility that's doing 50 of these procedures a month instead of 2 procedures a month. And I don't know about you, Erika, but I would rather go to a hospital or a provider that's doing 50 of a procedure a month than probably one that's doing 2, right? Not always, but usually you would. So I think we need more information on these price transparency files. We need, what's the quality outcome? What's the readmission rates for this hospital for this procedure or this provider for this procedure? Kind of quality ratings there that goes along with what's the best price and what's the best quality, who has the best price and who has the best quality.
Yeah. Yeah. And maybe that's even where to start, right? Think about what kind of care you need as a patient and where you think you can get the best care, not just the best care, but the best for your particular condition or situation, and then start thinking about the cost, right?
You know what? And you're really getting on the edge of that deeper conversation when you talked about grocery stores, going to get an item at a grocery store. How do people have that same experience in healthcare? It's not the same experience. Healthcare is so personal because of your own body and where you're at, and it is also emotional because it also ties into, do I have family members who can support me through this procedure? What's the easiest on my family member? What's the easiest on my care structure that I have at home? Those are all conversations that you need to have with your clinician, as well as, don't get me wrong, I do not think you should avoid the conversation of cost and what you can afford and what goes into your budget, because that's also important to have, but it needs to be all inclusive in that conversation.
Absolutely. Well, that seems like a great note to end on. Thank you so much for joining me today, Shawn.
Thank you, Erika.
That's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.